The book is called Skin Sense, the show is called Skin Sense, and I'm back here with my buddy, Dr. Steve Schleicher. We have a guest today, and we have Anna Lynch. She's a nurse practitioner. It's good to have you, Anna. Thanks for being on our show.
Thanks.
We're going to talk about the book, and we're going to talk about what Anna's doing with us, right?
Absolutely.
Thanks for having me on the show.
You're welcome.
I'm so glad you held up the right book.
I know.
It's so
Well,
embarrassing
I mean,
when you hold up somebody else's book.
It's the only book I have here with this ugly picture. But anyway, we'll talk about that later.
That's my mugshot.
I know. That's the first joke of the day.
Yeah.
Joke of the day. But anyway, there's some good stuff in here. It's how to protect your skin, a lot of good information. This is the updated book. We've been going through the chapters. It is a really easy read, but some good information on protecting your skin. And I know you have a new company now, research, right?
Well, I'm doing clinical research now.
Okay.
Okay. Name of the company is called Best Skin Research. And our main office is in Camp Hill. We're opening back in Hazleton, because I used to do clinical research here for many, many years. And we're opening an office in Miami, which is really exciting.
I love it. My two favorite states, Pennsylvania and Florida.
Yeah. And the winters up here aren't the best. So,
And not to
sneak down there.
mention, a blast from the past is going to be a part of this, and that's Dr.
Shipman. Yes.
Dr. Schiffman, a blast from the past. Now, we've been doing the Skin Sense show for how many years? We were talking about it. I mean,
A couple of decades. Since 1835, I think, was our first show.
since dinosaurs.
yeah,
And
since-
Dr. Schiffman, we were saying before we started, is the reason I started getting Botox. I was 28 years old, and I had this big crease in my head. And he said, you should get that thing. You should get Botox.
He's very forward.
In that crease. So thanks, Dr. Schiffman. It's been a pleasure. But
And
anyway,
now
I miss seeing
now
you.
you're 32, so
Yeah,
it's
now
only,
I'm only
been
32.
4 years. So,
I'm only 32. But he's a great guy, and he's doing great in Miami. So I'm glad you guys are teaming up
yeah,
together.
it's kind of cool. That's kind of cool.
Yeah.
So clinical research, the cool thing about clinical research, it helps a lot of people. Okay, we test drugs before they're approved by the FDA. And basically, people in our studies are mainly people who can't afford to be on medications or who have conditions that current medications don't even work for. Okay, so we're really helping out a lot of people that way. And I really can't wait to get back to Hazleton, because I was here for years doing clinical research, and I'm coming back. And Anna's going to be an integral part of doing the clinical research, okay? So she's trained in dermatology, and we'll talk a little bit about her background, which is pretty incredible also. So, and we have another nurse practitioner in Camp Hill now, Tatiana, they're both incredible people, they're both exceptional people. And again, I can't wait to be back in Hazleton. And Anna worked in clinical research too. And you could talk maybe a little about the medicines, about the conditions that we deal with in clinical research.
So when I work with Dr. Schleicher, we've, did research on multiple skin diseases. To name just a few: dermatitis, psoriasis, prurigo nodularis, HS, hidradenitis suppurativa.
And even common things like acne, and they're all common.
And acne, for acne, yes.
So, and we're working to develop new drugs for these conditions, which is really kind of fascinating.
If you read any research protocol, okay, so any protocol for any new drug that comes on the market, if you read the protocol, in the very first or second page, somewhere in there, you're going to find the words to fill the gap. And these are keywords because in reality, one drug may work for a person or may work for 1 million people, where it's not going to work for other people. So that's why we need to fill in the gaps, and we need to help everyone. Every drug works different on every person.
Yeah, and you raise a really good point.
Some of the best drugs out there, will help some people, but they won't help so many people or so many children. So that's why anyone that comes up with a new drug is going to say, in the desire to fill in the gap, we're coming up with this new drug and we're testing this, and that's why we're doing this.
Right, but you come up with a really good point, because some of the drugs are like miracle drugs. The problem is people can't afford them.
Also,
right?
another
You're
issue.
talking about psoriasis. we can clear individuals with psoriasis that we could never clear before with these new, you see them on TV all the time, the commercials. The problem is they cost $90,000, $100,000 a year.
It's a
For the
shame.
treatment,
And
yes.
who, unless you have insurance, you're not going to get these drugs. And for us being physicians, and for Anna being a nurse practitioner, denying patient a drug that can clear their condition is absolutely, it's horrible.
Well, even
and
going
sad.
back to something like acne, it might sound like, oh, well, it's this medication works for 1 million of people. Well, what if it works for 1 million of people, but what if it's like your kid that drug's not working for?
Exactly.
And the acne can be very stressful on a kid, right? That the acne.
You've had kids.
Right,
You've had kids with eczema, kids with acne.
Right, kids with.
How about eczema? How about dermatitis?
Right.
You itch
Dermatitis
until you
is-
bleed.
right.
And imagine children. You have 4-year-olds, 3-year-olds, 6-year-olds, or babies even that have dermatitis, and they'll scratch in the middle of the night, and they don't sleep. They lose sleep. And during sleep, it's when you produce.
It's not a big deal till it's your
It's
kid
so-
going
like,
through it, right?
They don't sleep. The parents don't sleep. Everyone loses sleep. Not sleeping. It's kind of like.
Well, yeah, because you send me emergency
not a good
pictures.
thing.
Right.
Yeah,
right.
of
If
a
eczema-
son with eczema.
I mean, eczema,
was
it can
pretty
tear your
bad.
skin out.
Yes.
Yeah.
Right, and
Yeah.
it
they
takes a
can
while to
bleed
go away.
and-
Right.
Yeah.
So if let's go back a little bit. So what do these so that people who don't know what these clinical studies do? How important are they? It's the research before these medications go out
Yes.
to an individual.
Exactly.
Yes, extensive research, clinical
Right.
trials, phase 1, 2, 3, 4, and so on. We do phase 1, 2, 3, correct, Doc?
Yes. Well, we actually do some 4.
Some 4.
But 4 are kind of like more aftermarket, okay? So after they've been released. All right, so phase 1 is very intense where people have to get blood drawn. Sometimes they have to get blood drawn every hour or every 2 hours during the study.
What phases will be done in Hazleton?
Well, Hazleton will probably do phase 2 and 3. And the other thing is, too, patients who are involved in clinical trials are getting paid to be in the trial. So not only do they get free medications, but they get paid for using the medication. So again, for people who don't have insurance, even Medicaid patients, many of them, they're not covered. The drugs are not covered. How are they going to get access to these drugs? Well, they can enroll in a clinical trial, and that way they'll get access.
Okay.
So pretty fascinating.
And when we say they're getting paid, we're paying for their transportation, for the miles. And if somebody has to go to work that day, they'll lose money for the day. So we will pay to make sure they can make it to the clinic. So that way they don't feel like they lose money that they could have made at work. So these are good for everyone. They accommodate anyone that really wants to put in the time and it's in great need.
So it's called Best Skin Research.
Yes.
Correct.
And it's
Correct.
happening right now in Camp Hill.
Yes, the main office is in Camp Hill. We've been in Camp Hill for about a year and a half or so.
And when will it start in Hazleton?
That's where, actually, one of the other things we're doing is we're doing a clinical trial tracked with students.
Okay.
Okay, so when you ask when, we've been looking at space at Lackawanna College.
Okay.
And 2 of my partners in this endeavor are world famous PhDs on staff with Penn State. Okay, and they have access to students internationally. So we are going to be the first in the US to basically have, it's going to be almost a year curriculum course,
Nice.
training people how to do clinical trials.
And why is that important?
That's very important because you need people with experience. Obviously, pharmaceutical companies are going to be looking for these individuals because they're going to fit right in. Clinical trials are a multi-billion-dollar endeavor. And, there's a shortage of people who actually know. We're one of the few private practices that do clinical trials. A lot of them are at academic centers.
Independent.
Yeah, we're independent because it is very, very difficult to do clinical. We have a staff of, almost 10 people just devoted to clinical trials. So the regular doctor is not going to be doing clinical trials in his office because number 1, you don't have the space. Number 2, you don't have the manpower. And number 3, you don't have the know-how to do that. And that's what we're going to be doing. We're going to be training students internationally, which is really, really kind of cool.
Awesome.
So yeah, we're taking students from India to start with, okay, the country India. And we hope to have 50 students for
At
the
least,
first semester.
starting in the first semester.
Yeah, which is really, really
We
exciting.
have big plans ahead.
Yeah, because both Anna and I love to teach. So for us, it's going to be a natural.
All right. If you didn't pick up the book yet, it's called Skin Sense. It's the 4th edition. Where can you get this book?
It's on Amazon.
All right.
Okay, Barnes & Noble too, and you go to their
Easy,
.com.
easy enough. Go to your phone right now or your laptop. You can pick it up. It's called Skin Sense. Some of the topics of discussion in the book are?
Well, just what we talked about, psoriasis, eczema, acne, and then sun protection because summertime, and even things like insect bites because we'll have to do a whole show again on that because there's some new diseases coming up, being introduced by ticks.
Right.
And actually, Anna was just in Colombia at a wedding, and I showed her before she left that there's this viral disease, actually it's spirochete disease, that's infecting ticks. And it started in South America, and now it's coming up here. It's kind of scary. So just be careful out there.
All right,
okay?
we're going to take a quick break, and we come back. We will talk about Anna's background and continue our discussion on best skin research. You're watching Skin Sense here on SSP TV. Welcome back. You're watching Skin Sense here on SSPT, talking about the book Skin Sense. And of course, it's all about the skin. And it's very informative. It's an easy read. It covers everything from psoriasis to skin cancer and everything in between. Dr. Schleicher, this is the 4th edition, right?
Correct.
And I know we've covered everything even from warts, right? And moles and getting your moles checked.
Yeah.
Yearly. I mean, it's really informative, even if it's something you think, oh, it doesn't affect me. If you have skin, it's a good read.
Yeah.
Right.
Hopefully
And
most people have skin.
Right. If you have skin,
yeah.
you can get it on Amazon. I think
Jeannine, most people have skin.
I think
okay?
it's
I have
like
to teach her
$2.
certain
So
things.
if you
and,
have skin, you can get the book.
Yeah.
Right,
yeah.
Anna?
Wow.
Yes, I agree.
But
And
actually,
Anna's with it,
you
Anna
bring,
Lynch.
You bring up an important point. What do we talk about? Well, how about sun protection? Because, we're in warmer weather.
Well, you should always put sunscreen on, and usually makeup has sunscreen on, but you should
Absolutely.
put sunscreen on before you go out.
Very important.
Yeah.
In
that should be
Florida,
reapplied
even
every
Well,
even
that's
in
right,
the
you
winter,
live in Florida
even
for
in
the
the winter
most part.
months, and you see, I mean, I'm originally from Pennsylvania, but when I moved down there, I've noticed that you can really tell people who are from Florida by their hands and their neck. And I'm always so conscious of even putting a lot of sunscreen on my neck and keeping myself protected, because you can tell that their skin has been very damaged from the sun if they haven't protected it.
Yeah, I just saw a patient the other day who came back from Florida, and her skin was so horrendous, and she had this tan, and she was bragging about her tan, and she had all these skin cancers on her, and it's like, oh my gosh, sometimes it's kind of hopeless. But
Some people are addicted to the sun.
yeah,
Yes.
and the sun has benefits,
It does.
I
Some
mean,
of it.
Yeah,
I walk every morning, but it's like maybe 8 or 9 in the morning. I wear my hat. You'd be proud of me. And I wear long sleeves, and I do wear sunscreen because I don't have makeup on at that
It'll be
time.
the first time I'm proud of you.
Right, ever.
Okay, well, better keep
But
wearing that
ever.
hat. That's all.
And
That's
I-
all I can
Hey,
say.
your skin is
But-
amazing. You just told me your age, which I'm not gonna repeat in
That's
in
okay.
front
I'm
of
okay.
everyone.
Yeah.
It's up to you if you want to say. But your skin is absolutely amazing. I'm shocked. I cannot believe your age.
I listen with the skin. I listen on that part because I've seen some of my friends go through the precancerous skin. I mean, it could happen anyway. It can. I
Right,
mean, some people
right,
are just
right.
prone to
and the
precancerous.
point is, if you're fair skinned, if you have red hair, if you have blue eyes, every time you go out in the sun, you're doing damage. Okay, and we have to get that point across to especially fair skinned individuals, because let's face it, people who are, Italian descent, certainly African Americans, they don't have to worry as much about the sun. They may have to worry about vitamin D because basically sun helps form vitamin D, and the pigment in your skin helps block that out. So we have to worry sometimes about elderly patients or African Americans who aren't getting sun. But by and large, no, you don't need sun to get vitamin D. Maybe 5-10 minutes a week is all you need.
You even get sun though, and I notice it more because obviously the sun is brighter and stronger in Florida, but in your car. Or
Well,
here.
drive. Some of the truck drivers, they'll have sunburn on the left side, or they'll have skin cancer in the left side where the window is, but nothing on the right side.
Or through
because they
your-
expose that
Well,
side
yeah, I mean,
more and more.
glass blocks out certain
Okay.
solar radiation. Okay, it doesn't block out all of it. But I mean, the good thing is a lot of the damaging, radiation is blocked out. But, what we are talking about drivers, with the side facing it, well, a lot of times they drive with the window down. So they're going to get, and they don't realize, sometimes you just don't realize, or people don't realize that, when you're out in the sun, you're out in the sun, and on cloudy days, you still, sometimes 80% of the solar radiation can penetrate through
You
the
get your
clouds.
worst sunburns on
And
cloudy days.
most
Sometimes
of the
you
damage
can,
happens
yes.
before age 20. And some of the young children, I have a daughter at 16 and a half, and she just loves the sun. And as much as I try to teach her every day and beg her, please put your sunscreen on, please don't. She just loves and stays in the sun. So I have to, it's like a Tom and Jerry all the time.
Fortunately, she's a little darker complected than you.
She
So
is.
that's good. But even still, I mean, you mentioned about little kids. I mean, it's been shown that little kids who have really bad sunburn have a much greater risk of developing the most deadly form of skin cancer, which is melanoma. So there's nothing more tragic than seeing a little baby left out in the sun. I mean, that's really bad. And you see, you go to the beach and whatever, you see that. It's really kind of tragic.
So the clinical research that you're doing, which is called Best Skin Research, if you're just joining us, is the new clinical research group that is forming here in the Hazleton area soon, and then in Miami as well. It's now going on in Camp Hill
Correct.
in Pennsylvania. And this is going to help with these different skin disorders, right?
Absolutely. Yeah.
And Anna is going to be a part of it. She's a nurse practitioner. So Anna, we have a couple more minutes left. Give the audience a little bit of knowledge on your background.
My personal background,
Yeah,
not my profession.
yeah,
Okay,
your
so
profession.
I am originally from Romania.
Yeah.
And I came to America when I was a few months shy of 20,
Okay.
with $300 in my pocket. And I actually ran away from home to America. My dad didn't know. I managed to get a visa for America, which at that time was nearly impossible. I guess I was just lucky. I borrowed money from some neighbors, and I borrowed $1,000. The airplane ticket for America was $700, and I had $300 left in my pocket. I packed a little suitcase, didn't have much to pack to begin with, and I literally ran away from home to America. And back in the days, I mean, my parents were very traditional, and if a daughter didn't came home all night, that was a big deal.
Oh,
Like
yeah.
they
Anywhere
probably
is a
called
big
the
deal.
police, the whole neighborhood looking for me. I was on the plane coming to America. And so when I landed, everyone was breathless to see what happened, probably waiting by the phone for someone to call. And so I called my mom, and she's like, "Are you alive? Where are you? What happened?" And so I told her I'm in America, and she passed out. So I had to call back 10 minutes later.
I guess so.
And talk to her, or a couple of minutes later, I don't remember. And I told her, "Mom, well, I paid $100 for the hotel, $80 for the cab to go from literally JFK. I told the cab driver, take me somewhere in New York City. I don't even think I knew the difference between Queens and Manhattan. I thought New York is like just a city, New
Yeah.
York. And he literally took me from JFK, dropped me at LaGuardia, at a hotel in front of LaGuardia, and said, "This is New York." Charged me $80. We're talking about maybe 30 years ago. And so I had about $120 left after I paid for the hotel and the cab drive, the taxi. And I called my mom, and I told her, "You need to find someone because I'm in America and I'm going to be on the street in maybe one more day. I'm going to be homeless." And so she panicked, of course, but my mom she was amazing, one of the best women out there ever on planet Earth. And so she knew a lot of people, and she just went to church, she went through the whole neighborhood, she went through all the neighborhoods until she found a family to take me in. So she gave me a phone number. My mom called me back actually at 5 in the morning. It took her about 8 hours or so from at night when I called her until 5 o'clock in the morning the next day. So at 5 in the morning, the phone rings in my hotel room, and I would have been out of that hotel room by 10 o'clock. I don't even know how I slept that night. And she gave me a phone number for this Romanian family that helped other immigrants along the way. And so I called this family at 5:10 in the morning. And I told them I have this number, your number from this person, because it was from a person, and I need help. And they said, okay, where are you? We're in Queens. They were literally 10 minutes away from the hotel, maybe 7 minutes away from the hotel. And they said, well, we'll come pick you up. We will help you. We will not let you on the street. We helped a lot of people. But there's one problem. We're leaving to Orlando. They had a house in Orlando. And so do you want to stay in New York by yourself, or you want to come with us to Disney World?
Talking about breaks,
And
right?
I said, Orlando it is. So
oh
my
my
first day in
God.
America, I actually packed and I went to Disney with them. They drove,
Yeah.
to Florida.
You roughed it out, huh? You had to drive.
So, yes, no, I didn't drive.
And the rest is
No.
history.
And the rest is history,
Good for
yes.
you.
Yes, and I love America.
You better buy lottery tickets.
Growing
I
up
mean-
in Romania, in a communist country, back in the days when I was a child, if there's one point that I want to make. During communism, just to give an example, when the song with Madonna came out, Like a Prayer, everyone knows that song?
Yeah.
Like a Prayer. That was banished. That was illegal in Romania because there was too much, whatever. It wasn't an appropriate video.
Yeah.
But my neighbors had family in Germany, and they smuggled through the border during communist Romania. They smuggled a DVD player and a couple of videotapes, and one of the tapes was a tape with this song, Like a Prayer. And I remember during the communism, the neighbors invited us. We were in the circle of trust, so they invited us to watch this video. Imagine a room half the size of this room right now, and maybe 20 people were gathered, and we were sitting like this, and quietly, with the volume very low, we were listening to that song. We couldn't even jump or dance or enjoy the song, because if anyone would have found out, the police would have came and we'd have been arrested.
So it's very,
this is
very-
how communism is.
Yeah.
It's not fun. And
So you're
growing up in
country.
growing up in Romania, everything that I've learned about freedom, happiness, rights, was from the American movies. And I'm telling you, this is the best country in the world. I am very lucky.
Good to have you.
Well, that's
Good to
great.
have you.
Happy and proud to be here.
Well, I love when
And to
people
work
say
with
that.
Dr. Schleicher.
Well,
Well, that part.
yeah, that part.
We
Yeah,
got
yeah,
that part
yeah,
out of the show.
yeah.
I'm kidding. Well, good to meet you, Anna. And
Thank
I
you
wish
so
you
much.
guys luck.
Thank
Again, it's
you.
called Best Skin Research. The book is called Skin Sense. You can buy it on Amazon. It's always nice to see you guys, except for there's this picture right there. Skin Sense. And thanks for joining us here on SSP TV. We'll see you next time.